My name's John Davidson. I've been here at the Bone and Joint Centre since the very beginning. My main interests are knee replacements, hip replacements and soft tissue knee surgery. I perform in excess of over 200 knee and hip replacements per year. A knee replacement is an operation that we do to get rid of pain and restore function, but primarily to get rid of pain. It's an operation that involves taking off the worn-off surface of the joint and replacing it with metal and plastic. There are in excess of 60,000 knee replacements done in England and Wales every year. It's an operation that's now very successful and it has been done for nearly 50 years. It's been developed over those years and has been constantly improving. But we very much consider a knee replacement to be a soft tissue procedure because it's all about having the knee balanced and well aligned. When I see patients here at the Bone and Joint Centre, I frequently use models to demonstrate the anatomy and show them what the problem is. These are models of a knee. This first one shows the normal surface of the joint, which is nice and smooth. The model in the middle shows what happens in an arthritic joint. The surface becomes roughened and distorted, and that shiny gristle off the surface of the joint has worn off. The third model shows what we do in the joint replacement, and you can see that the surface has been taken off and replaced with metal and plastic. So this is a model of the knee, and you can see what we do in a knee replacement is we take the surface of the bone off with a series of cuts, and we then replace that with metal and plastic to form the knee replacement. Some people think we take the whole of the knee out and replace it like this, but we don't. We just replace the surface of the joint. Your ligaments get left behind, your muscles get left behind, and they're what allow the knee to function afterwards. Things have improved quite significantly over the years. We wouldn't expect patients to stay in hospital for more than 2 or 3 days following a knee replacement, whereas in the past they were often in for a week or two. And the rate at which people recover and get over the procedure has also increased quite significantly. It's not uncommon to see people back playing golf and rambling without sticks or crutches at 6 to 8 weeks these days. I usually tell patients that it takes about 3 months to get 90% over the procedure, but the healing process carries on for at least a year. The harder patients exercise, the better the result they get. Patients often ask me, how long will the joint replacement last? They often think that they only last for 10 years. This isn't strictly true. We do know that things have progressed over the years and designs have improved quite significantly. But even with older designs, which was state-of-the-art technology in their day, have an 85% chance of lasting 15 to 20 years. With current modern designs and new materials, we'd expect them to last considerably longer than this, but they're very much dependent on what patients do with them. For the last 18 months, I've been putting in a new knee replacement, and we've been extremely encouraged by the early results. Patients are rehabilitating and getting over the procedure an awful lot quicker than with previous designs. Joint replacement, however, is really a last resort. It's usually done for end-stage disease. There are many other conditions, particularly in the knee, that there are other things we can do. Most commonly is keyhole surgery. Keyhole surgery is predominantly performed for conditions that affect the meniscus. The meniscus is what most people refer to as the cartilages. These are like shock absorbers in the knee that frequently get damaged either in sporting activities or as we get older they become more brittle and can split with less force. Keyhole surgery is usually a day case procedure that we can deal with the mechanical problems in the knee, and it's a long way away from joint replacement.